I think there has been people who, sadly have been the wrong people in that role. I think most of the welfare officers that, and I'm lucky to have spoken to an awful lot of them over the periods of time. Most of them are, certainly well-meaning, and some of them are very well trained, because actually some are professionals in a child safeguarding field. Of course, I myself have actually been, in another sport, I've actually been a welfare officer myself for a football club. So I think there's a lot of well-meaning. There's a lot of a lot of good professionals around that actually perform that in a volunteer basis. But of course, the demands of their own jobs, the demands of the sport, and swimming included itself, and the other aquatic sports, mean that role can be very demanding. And it could be that some people that actually are volunteering for the role don't actually, fully appreciate the demands. Actually, I know there was over a period of time, there's a significant turnaround on the amount of people actually performing the welfare officer role. I think that's reduced a little. Obviously, the best equipped people to do the job are the people that are, fully understand and perhaps are involved in child safeguarding, child protection, from the statutory agencies, who perhaps more fully understand the demands of the role. Having said that, there's some excellent volunteers who are really, really good in the role and very, very supportive to children and families within clubs, and do some excellent work. But quite clearly, that's not necessarily always the case. Sometimes there are compromises, and historically, even perhaps some coaches or perhaps some people that aren't quite so receptive to the welfare officer role have performed that role. But it's so there are some gaps, certainly. I think training is key for them, and an honest approach to recruitment and making sure they're aware of the demands is also key to it. We would always encourage any welfare officer to, if they're dealing with, for example, a mental health issue for a child, to actually involve the family as much as possible, give the advice to actually seek, perhaps organisations like GPs and their local surgery to actually help them get referrals. We obviously know that there are significant demands and significant delays in in provision of services currently across the country, and some of those statutory services are very much delayed. But we would always encourage them to seek, if they can, advice where they can. There are a number of organisations that are really good about giving specific advice around specific areas, be it self-harm, for example, or eating disorders, etc. So there are specific organisations online and that actually most national governing bodies have a very good relationship and good way of actually signposting these kind of positive services. It's, I suppose, some of the key issues where organisations get it wrong is actually not speaking to the experts, perhaps not referring concerns up the line as early as they need. Certainly had clubs that are tried to deal themselves with, quite serious cases, sexual assaults, etc., and significant mental health issues, tried to deal with it themselves without the expert support, really. And for me, the key to it would be actually supporting those welfare officers and making sure that they can have somewhere to turn to, rather than trying to deal with things themselves where things can go wrong.
Young men between 15 and 24 years old are 3 times more likely to take their lives than female peers. RCPCH, State of Child Health.